I'm seeing someone on the call. I welcome everyone to this lecture. Today is a psychology lecture. It's going to be on understanding patient behavior. You see, for us, we are healthcare professionals. Well, most times the challenges in health facilities that come around come on come because of doctors failing to understand the patient behavior. Most times we receive patients who can't even talk, whereby you as a doctor, as a professional, you must be good at interpreting various communications. Deep alone in in this module of psychology, we shall see doctor-patient relationships, we shall see effective communication during health, and very many other things. However, today we are going to be looking at understanding patient behavior. We are going to these are the lecture objectives for today. We are going to look at it. We must know how to define patient behavior and its importance in healthcare. We must have learned how to we must explore the factors influencing patient behavior, of course, including cultural background and very many other beliefs. Yeah. We are going to we must also learn to examine the impact of patient behavior on treatment adherence and health outcomes. Usually, we receive various patients at our facilities, and before administering any treatment, you must first look at the behavior of this patient. Sometimes we health workers we decide to retain our patients at the ward, and we admit them at the ward. Sometimes we sometimes we prefer the outpatient treatment, whereby we send them home, they come back the next day for the next dose, like that. However, what do you base on to make a decision that I'll admit this patient of mine to the ward, and I watch them from here, or I'll send them to go home? That's why we need to learn to investigate and to learn how to investigate patient behavior, and it helps us a lot in decision making. We get it, eh? That is the significance. We're going to see that by the end of this lecture, we shall be able to manage all categories of patients that we shall be receiving at our health facility. Once again, I welcome everyone to this call. The number four, we shall discuss the strategies of health professionals to effectively communicate with the patients. Yes, yes, to ensure that there is an effective communication between you, the health worker, and your patient. And we must address the challenges in behavior. You receive very many patients at your facility with various behavior, and as a trained health worker, you must have learned how to handle various behavior in health. Um, the number five would be identifying the common theories and the models used to explain patient behavior in healthcare settings. Yes. Now we are continuing to start our lecture. Those are our lecture objectives. I'm trying to maintain this screen such that you can determine your lecture goals as we are going to start. Yes? Yes. Okay. When we go to the next slide, we are looking at the terms related to patient behavior. And to start with is behavior itself. Yes? Patient behavior refers to the actions, reactions, and responses exhibited by patients, by individuals seeking medical care and undergoing treatment. Yes, yes. Actions, reactions, and responses. That's now the word behavior. And then patient behavior is reflected by those individuals who are either undergoing treatment or in the individuals who are seeking for medical care. So whatever they go through, referred to as behavior. Then healthy behavior, those are the actions taken by individuals to maintain or improve their health. For example, exercising regularly, eating a balanced diet, regulating alcoholism and smoking. You get it, eh? Yes. In other words, healthy behavior are those daily activities that we do that can promote our health. Compliance as a term, it is the extent to which a patient follows medical advice, treatment plans, and recommendations provided by the healthcare providers. Remember, compliance is one of the final stages of healthcare provision. Yes? If you administer a treatment to a patient, the goal is to treat that patient. However, the patient will be cured, or you shall have treated the patient if they are compliant to your treatment. You get that is, and compliance to treatment is very much associated with the patient behavior. Adherence, adherence. Is your patient adherent? That is another goal of treatment. You get it? Yes. So similar to compliance, adherence specifically refers to the degree to which a patient follows prescribed medication regimens. By medication regimen, we mean the dose, the dose you administer, 2 times 3 per day. You tell your patient, take this in the morning, take this after lunch, take this in the night before sleep. So if your patient responds to that regimen is like a schedule. Yes, if the patient responds to that schedule, then they are adherent to treatment. Usually we tell patients that whenever you take this type of tablets, do not take alcohol. But patients later try to during treatment they tend to take that alcohol, meaning such a patient is not adherent to the dosing regimen. I've told you, regimen refers to the schedule. Medication regimen, the schedule you give your patient. We get it, Good. When we go to the next slide, patient engagement. Hmm? Patient engagement. So it is the involvement of patients in their own healthcare decisions and treatment plans, as well as their active participation in managing their own health. You get, first and foremost, the patient engagement begins with visiting the doctor whenever such an individual is not feeling well. There are individuals, especially in local setting, for them they will never see a doctor when they are not feeling well. Eh? They will never see a doctor unless it has squeezed them to the maximum. You get, Yes. Taking a decision to go to the healthy facility, that is one of the steps, the first step of patient engagement. Then you, the doctor, the patient now has come to see you. How are you approaching them? It is also another step in patient engagement. And then the finals, that is understanding what they are going through, what they have told you, and then you administer certain treatment and the patient gets healed. And so for that case, it is the involvement of patients in their own healthcare decisions. So as you're telling them a decision to make, hmm, as you, I mean, before you choose to make the decide to take that procedure, you must engage your patient because it is ethical. In the nursing profession, we even take vows. We recite the oath. When we are graduating, we recite the hypocrite, the oath. Hmm? Yes, that the nursing oath. You get it, So that oath means that you will never violate the patient rights. Then health literacy as a term, it is the ability of individuals to obtain, process, and understand basic health information and the services needed to make informed healthcare decisions. You, as the health worker, before administering any treatment, you must make your patient understand what you are administering. You must make your patient understand what you are actually doing. You get it? Yes. So as they understand that process of them understanding what you are saying on according to their health, you get, is what we refer to as health literacy, getting the knowledge, obtaining that knowledge you're giving them. I hope that the point has reached you. Uh, Importance of patient behavior. That is a very crucial importance of patient behavior. How does patient behavior help us in administering treatment? You get it? And to start with, treatment adherence. The behavior of an individual determines a lot on how they are going to adhere to your treatment and to your dosing regimen. You get it? Yes, it will help us a lot. Patients who use the marijuana and other drugs in that category, you fear that they might not adhere to your treatment very well. You get it? So that's how patient behavior determines the adherence to treatment. Then health promotion and disease prevention. Eh? Understanding patient behavior will help us a lot on promoting health and preventing disease. You get it? You have your patient. Your patient has a high blood pressure, and you find out that your patient does not do regular physical exercises. They are always seated in one area in a room. You get it? Meaning, when you understand their behavior, it will direct you on what is the cause, on what is the etiology of their condition, and it will direct you on the treatment to administer to your patient. You get it? Yeah. And then communication and shared decision making. Patient behavior will help you a lot to enhance communication, to strengthen that bond between the patient and the doctor. You get it? Such that whenever you're going to make a treatment decision, the patient has that capacity to take the decision. Some patients are minors, are under the age, the constitutional age, so they cannot decide for themselves. Some patients cannot talk; they have specific disabilities. You get it? So you understanding their behavior as patients will enhance decision making and communication. Patient satisfaction and experience as another important in patient behavior. You see, the behavior of a patient, it determines whether they will be satisfied with your treatment, with your services provided by you as the health worker. You get it? Yes. So patient satisfaction is determined a lot by understanding the patient behavior. You as a health worker, how are you going to know that my patient is satisfied with the services I have provided? You get it? Yes. So once you understand the behavior, you can know that when this patient produces such and such a reaction, they are actually satisfied with the experience in service. Then healthcare costs. Hmm? Healthcare costs. Patient behavior can impact healthcare costs a lot. You get it? Through factors, for example, unnecessary emergency room visits, non-adherence to treatment. When such a patient is not adherent to treatment, it will increase costs. You get it? And also, as a health worker, when you understand the patient's behavior, you will know that to minimize costs, I will not administer such a treatment. You get it? I know that because if I administer this treatment, it might go to waste. This patient is undergoing uh, mania. Manic patients are always excited. You get it? Always there, jumping there from here and there, just excited. I'm talking about now mental health. Manic patients, mania. Hmm? Overexcited all the time. So by the time you give them your treatment, they will throw everything away. You get it? Yeah, sometimes we administer, we put them on drips. We put them on drips, and you find the patient has broken everything. Everything is no longer intact. You get it? So, and what it does, it will increase the cost because if the health facility doesn't meet the costs the patient has wasted, then the caretakers will meet those costs. So either way, you must understand your patient behavior and know that now I will not give drugs. Neither shall I put this patient on drips. Or if I'm to put this patient on drip, I will first administer a relaxation drug. Hmm? We have a drug called carbamazepine. We usually use it in psychiatric wards also. Carbamazepine. It helps us a lot on solving convulsions. The other time I talked about convulsions when the body is shaking a lot. So carbamazepine is a muscle relaxant. You get it? Yes. So you sometimes we can first administer that drug, then the patient first relaxes, and then we put the patient on drip, and we time it very well that by the end of this 1 hour or two, this patient shall have awakened, and we must the drip must also have finished. So that's an importance in understanding patient behavior. Um, we proceed now to the components. Very important, very important components of patient behavior. These components are very essential, and they are the things that you look at when you are investigating this person's behavior. And even the things we are going to look at uh, under this concept are going to be rotating around these concepts. You get it? First and foremost, compliance. I've talked about compliance already. Hmm? Is this patient compliant with with the directions you give as a health worker? You get it? Will he comply that take this medication at this time, but make sure you must take the medication after a meal? We usually tell patients that don't take this tablet before eating. Only take when you have eaten something. And sometimes patients do not comply and they do the opposite. Someone says, after I don't have what to eat and my time for swallowing the drug has come. So they just swallow the drug. You get it? Like that. And what results are usually peptic ulcers. You get it? And other stomach gastric disorders, craving. In fact, the condition worsens. But where does it come from? Compliance. And compliance is a component of patient behavior. Healthy beliefs. What does this patient believe within themselves? You get it? Usually we go to health facilities and you are sure that this one has the most treatment ever. You get it? Yes, and then with that belief, the patient you tend to go to that facility, receive the service. You get? Yes. So health beliefs. What do they believe that Western medicine does not work? These are some of the things that you will meet in your patients, in your communities, in your health facilities. Your patient will come at the ward and they will ask you for Panadol, eh? And you're like, Panadol is not available. However, I'm going to give you aspirin. It also works the same way. But because they believe that it's only Panadol which can cure a headache, the patient says, no, me I only know Panadol. If you give me aspirin, it will not work. I'm not going to take it. Health beliefs. Beliefs came in COVID-19. Many of them. Some people were like, doesn't exist. Others, it exists. You get it? In some countries, at first, we are not accepting. Others, for them, they were accepting that the condition was there and they were adhering whatever they were. So, beliefs, that's how they affect patient behavior. Emotional factors. Hmm? Yes, emotional factors. This also emotional factors combined with cognitive factors. The two reflect the personality. You get it? Yes. So patient's emotions, for example, fear. Is the patient fearful? Anxiety, stress. Is the patient stressed? You get it? So such emotional factors can very much affect their behavior in the healthcare setting. Hmm? Emotional responses to illness or medical procedures can impact decision making. You get? You might not receive the best decision when your patient is undergoing stress. You get it? Yes. Even such factors will hinder effective communication between you, the health worker, with your patient. Cognitive factors. This comes to thinking and other cognition skills. Hmm? Understanding the information you are telling them, problem solving, decision making. You get it? All of these ones are cognitive factors, and they are very much components of patient behavior. You get it? Yes. So cognitive factors can influence how your patient processes medical information. You get it? Because you have to explain to them every treatment procedure. You get it? However, do they understand what you're telling them? Cognition factors come in. Then social factors. social factors, the presence of supportive relationships, for example, family members. Eh? Yes, does this patient have adequate social support? Does he or she have members available for them? You get it, eh? Are there members who shall try to comfort them amidst the condition they are going through? HIV/AIDS positive patients. They have a supportive family around. You get it, eh? How are their caretakers? Are they just for some matured individuals? You get it, eh? Yes, so that is the social support. Then cultural influences. Hmm? The patient's cultural background. This very, very much affects their beliefs, their attitudes, and their behavior. You get it, eh? Yes, so cultural influences tends to become another component of patient behavior because different cultures have different norms, they have different values. You get in African culture now, for us, we believe in herbal medicine so much. You receive a patient, and patient will tell you, yesterday I took such and such a herbal. Eh? And you may believe it works more than your medicine. You get it? Yes. So cultural influences are a lot part of understanding patient behavior. Then environmental factors. Hmm? The physical environment in which the patient lives. You get it? Where does such an individual practice such and such a behavior? Eh? What are the things around them? You get it? Eh? Are there resources for self management? Can this individual access food whenever it is required? You get it? Eh? So environmental factors are also a component of patient behavior. Then factors influencing patient behavior. Yes, among the factors influencing patient behavior, we have the individual characteristics. You get it? Individual characteristics, their personalities, eh? The patients as themselves. You get it? It influences a lot patient behavior, eh? Emotional control, psychological states. You get it? Yes, that is so much. Sometimes even these biological characteristics, for example, height. Even height, by the way, influences a lot patient behavior. The way your patient will behave at the health facility, hmm? Because they will reflect whatever they do in their daily life. You get it? Yes. Then when it comes to social determinants of health, hmm? For example, uh, doctor-patient ratio. Eh? Yes, those are all social determinants of health. Levels of income, socioeconomic levels. Those are all social determinants of health. Poor people will have a different behavior from rich people. That one is literal. It can be seen easily. Eh? Yes, children who are born from rich families, when you have them at at your health facility, they will have behave differently from children who come from poor families. You get it? However, there is no standard that that the rich will behave well. No, it is not. I'm not saying that. I'm saying they will behave differently, but there's no standard that these ones will behave well. There's no standard. However, the difference is that because these ones can access any service they want, therefore, they will even try to mock you, the doctor. Eh? Sometimes now these days we have what we call Google patients. Patients who come when they have already Googled their symptoms. Those patients who have access to the internet. They come when and they tell you, you know what, doctor, I think I'm going through such and such a cancer. You ask them, why are you saying like that? I have a certain I have itching around my groin region. And when I googled at the internet, it indicates cervical cancer or prostate. You get, and actually, yet actually it is not a cancer. So such patients, you will receive them at your facility, and they tell you such things. And where does it come from? Social determinants of health. Then health literacy. Health literacy, we saw it is the ability to understand the patient information provided by the doctor to their patient. So it is the ability of that patient to understand what you're telling them. Once they are able, then they are literate as far as health is concerned. Then provide a patient relationship. It also influences a lot patient behavior. How are you related to your patient? Do you communicate effectively? Do you first do you look tough at them? Do you always expose that worst face always when you are talking to them? Eh? Yes, that's what we mean. Provide a patient relationship. and it influences a lot patient behavior. It will influence how your patient will behave. They might fail even to comply with your treatment if you are tough. You get then cultural influence. It also influences patient behavior very much. We have seen that culture, because of the different norms, because of the different values, such culture influences a lot on either to seek medical care or not, on either to comply the doctor's directions or not, on either to adhere to treatment or not. It all comes from cultural influences. We have some cultures which do not want to look at blood. Eh? So a patient will come to a facility and they have something, for example, in their stomach. eh, And you tell such a patient that you're going to undergo surgery. Eh? Yes, you tell such a patient that you're going to undergo surgery, but because their culture doesn't believe in such, they will tend to ignore. You get it, eh? And their culture shall have influenced how your patient behaves. Going to the next slide, uh, we have the impact of patient behavior on treatment adherence now and health outcomes. How does uh, how does patient behavior impact your patient's adherence? Hmm? Yes, first and foremost, we have behavior which shall motivate adherence of your patient to treatment. Of your patient is adherence to treatment. Motivation. You get. We have behavior that shall demotivate instead. You get. But a better behavior provides motivation, adherence to treatment. Then beliefs and attitudes. If they have positive beliefs about the medication, eh? Yes, if they have positive beliefs and attitudes about that medication, they will comply what you tell them, and they shall have adhered to the treatment. I request, is it George? Kindly mute your microphone. It is providing background. George?
Okay.
Yes. Good, good. Then I've talked about beliefs. Then perceived barriers. Eh? uh, the perception, this is in line with cognitive abilities, with the thinking, with the personality. Eh? Perceived barriers. Uh, Patient behavior tries to limit barriers to adherence, and instead, your patient will adhere their treatment. Health literacy, like I've told you, their ability to understand what you tell them or what you direct them. You as uh the health worker. You get it? Yes, so that's what we mean by health literacy. The patient's ability to understand what you tell them. Then psychological factors also provide an impact on adherence. Hmm? Yes. Psychological factors. I've given you an example of mania. Eh? An individual who is undergoing mania, they're always excited. They will not adhere to your treatment because they don't even understand what is going on. You get? Then we have psychological factors, for example, stress. Eh? The patient might have understood what you're saying, but because they are stressed, they don't take it as if it is crucial. You get anxiety. Patients who exist with the fear. You get it? Those are all psychological factors, and in case they are absent, we shall have adherence to treatment. But in case they are present, your patients will hardly adhere to what you direct them to do. Then lifestyle choices, alcoholism and smoking cigarette, eh? Use of drugs, for example, marijuana. Hmm? Um, Always seated. Your patient is always intact in one room. Eh? Most especially people who work in offices. They leave home at around 7 or 8. They go to work. They leave at 6 or 5. When they come back home, they just sit down. They don't do some physical exercise. Those are all lifestyles. You get it, eh? Yes, and such lifestyle, if they are positive, they will favor adherence, and they will produce positive health outcomes. You will direct your patient that, please, when you go home, please start doing some physical exercise. Please, you can join some gym classes, you do some aerobics, you get it. But because of their lifestyles, because for them is used to sitting down, and those bad lifestyles, they will instead produce poor health outcomes. Going to the next slide. uh, that is effective communication strategies with patients. Yeah, this is very important and very crucial. These are the strategies that we as doctors can use to improve on patient behavior. eh, so that we can to improve on patient behavior so that we can have positive health outcomes. First and foremost, you as a doctor, you must be able to have active listening. Listen to whatever your patient is talking about. First, listen to them before you actually ask anything else. Yes, ask a question at a time and they explain to you. You get it. And what they explain, listen to it, then decipher and get what they are telling you. Stop arguments. Then empathy. Empathy means you as a doctor, you must it literally you must put yourself in the patient's shoes. You get it? Yes, put yourself in that position of that patient and try to feel what they are feeling. And there you will try to administer the medication or the treatment according to its requirement. Yes, then use a clear and simple language. Sometimes the patients come to our facility. Patient is saying that I'm having some fluids, they're coming out of my private parts. The fluids are smelling like fish, they are fishy, they have a fishy smell. And of course, in the medical profession, a fishy smell or fluids coming out of private parts indicates bacterial vaginosis. Yes, so for you as a doctor, what you do, you start now telling your patient that, according to what you're telling me, I think you have bacterial vaginosis, and it is coming from your normal flora was being disturbed. Perhaps you started practicing dodging, and it disturbed your normal flora, and the normal bacteria which were there were called lactobacilli, and lactobacilli were replaced. You get it? I'm also trying to talk at a speed to reflect what we health workers that mistake usually make. Hmm? Yes, like what I'm trying to say, use a clear and simple language. Don't speak your normal flora and lactobacilli and bacterial vaginosis with your patient. You get it? Use a clear and simple language that perhaps you have an abnormality in your perhaps in your urinary tract and it came up because you did this and this. You get it? Yes. Then mind about your non-verbal communication. Some patients are hopeless. They don't have hope. You get it? Therefore, they get hope from you, the doctor, the medical worker, the nurse, the midwife. Eh? Once you produce, you put on a facial expression, which is scary. You get it? Because facial expression, sign languages, those are all non-verbals. Yes. So you mind about the sign languages you're using. Mind about your facial expressions. Don't do something that will make your patient lose hope. You get it? These are all strategies to improve patient behavior and to also improve the doctor-patient relationship. However, like I've told you, we shall have a section on communication skills and improving the doctor-patient relationship. Then another strategy is setting boundaries. Yes. However much we want you to have a good language. We want you to be empathetic, but don't forget you are a healthy professional. Please don't behave like someone who has come from anywhere outside the field and just starts administering treatments. Hmm? Behave like a doctor, dress up in your professional attire. You get it? Use a professional language. Don't speak obscene words. You get it? Yes, that's what we mean by setting boundaries. Some male doctors try to harass female patients sexually. Hmm? Yes, that is also lack of professionalism, and that means you have not set boundaries between you, the health professional, and your patient. You get it? Then collaborative decision. That's also a good strategy because if every time you're going to make a decision, you involve your patient, how do you see if we do this? How do you see if we do like this? You get it? And then the patient is like, what can that help? And then you as a doctor, you're like, if we do a root canal on your tooth, this and this will happen. However, if you don't want a root canal, we can just perform a cementing, tooth cementing. You get it? Try to give different alternatives and then collaborate with your patient to make a decision. Sometimes we have patients who are minors, like I said, who are children, some cannot talk, you get. Some have disabilities. Those ones, try to communicate with their caretakers such that you make a decision which the caretakers are also aware of. Then cultural sensitivity. Eh? Yes, mind about the background of your patient. Where is he or she coming from? Such that you determine the level. Yes, you determine a specified treatment for them. Sometimes, like I told you, some cultures do not want to look at blood. Hmm? Yes. So if you just tell your patient that you want to administer something without considering that, eh, you might bring in problems. The culture, for them, they are homophobic, and then your patients develops very, very tough conditions. You get it? Therefore, be culture sensitive as you are administering health care. Then conflict resolution skills. Yes, sometimes our patients will leave when they haven't understood something. You get it from you, and then you have to make sure they have understood. You get it. Those are conflict resolutions. It leaves the conflict in them whenever they have not understood a procedure. Sometimes conflict comes from your procedure doesn't match with the with the healthcare costs that you have told them. Some doctors, he has performed a very small procedure and is asking for millions of money. You get it? Yes. So you as a doctor, you must be able to relate so that you can resolve such conflicts. Don't allow your patient to go when they are unsatisfied. You get it? There, you shall have improved the patient behavior and you shall have enhanced your relationship with them. Um, Coming to the next slide. Now, this is now a crucial part. This is to do with the theories and models in patient behavior. Many people tried to postulate various theories and various models on patient behavior. Yes. So they try to postulate them, and it is what we are going to do at. And in the end, we shall see the role of these models. Yes. Uh, Several theories and models have been developed to explain patient behavior in healthcare setting. These theories and models provide insights into why patients make certain decisions. You get it, eh? Yes. So they are going to direct us on why do patients decide to do something like this or like that. You get it, huh? Yes. So such models may include the health belief model. We are going to see it in details. We have the theory of planned behavior. We shall also see it in details. Uh, we have the social cognitive theory, stages of change model, and self-determination theory. So these models and theories provide frameworks for understanding patient behavior in both care settings. You get it, eh? Yes. So let's get them in our next slide. The health belief model to start with. So the health belief model states that individuals' health behavior are influenced by their perceptions of the severity of a health issue, susceptibility to the issue, and the benefits of taking action to address it, as well as barriers to taking action. The health belief model is based on what the patients perceive as, is this issue severe? You get it? Because this all determine whether your patient will come to your facility to seek for health care. So, what they perceive to be, is this condition severe? If not, I will wait here and then I will go later. Am I so much susceptible to this condition? Hmm? Usually, I mean, at first in COVID-19, they used to say that it affects so much older people. So some youths became reluctant and they were saying, yeah, after all, I'm not even susceptible to it. Not until later they confirmed that even youths get affected. You get. And then benefits of taking action. The patient will look at how am I going to benefit if I go? What do I lose if I don't go? Seek healthcare, their own healthcare, imagine. So this model helps us, the healthcare professionals, to understand what do patients have in mind whenever they become sick. You get it? Yes. So this model suggests that individuals are more likely to engage in a health promoting behavior if they believe they are at risk and that the recommended actions will be beneficial. Am I at risk of obesity? Okay, if I am at risk, then let me start physical exercise. But because an individual is not seeing it, sorry, because they're not growing a fat, so they are like, even if I don't do physical exercise, because after all, I'm not even fat. You get it? Yes. So until they find out they have the risk factors, that's when they start doing the needful. Uh, Coming now to the systematic illustration, I tried to provide this systematic illustration to help us understand more of this model. Yes, those who are watching it right now, you can see the demographic variables and then psychological characteristics. Yes, class, social class, economic class, that's what we mean by class. Financial levels, gender, age. You get those are some of the demographic variables that can be based on to determine whether this patient will seek care. And they are the ones which they base on to determine whether they are susceptible or whether they are at risk. Then psychological characteristics such as personality, peer pressure, all of these ones determine whether patients based on these ones determine whether they are actually at risk of the condition. Mm? So you can see the arrows take you to perceived susceptibility. Mm? Sometimes some people be like, after all, I'm not a woman. It is women who are at risk of breast cancer, forgetting that even men have breasts. Eh? So they are also susceptible to breast cancer. Are you seeing how gender is trying to determine susceptibility? Sometimes people have some solid particles in their breasts, men, eh? And they are like, I'm a man. This cannot indicate that I'm having any condition. Eh? Yes. So they or sometimes it determines they base on that and say, since I'm a man, not yet severe. Yet it has already advanced it to further stages. You get some people be like, after all, I'm not old. I'm just a mere youth. I cannot have such a condition. You get it, So those characteristics try to bring us to can cause motivation. They can give perceived benefits and also give perceived barriers, and all of these one can lead the patient to take action. Going to the next slide. Uh, okay, excuse me for that. Then we go and look at the strengths and weaknesses of the healthy belief model. First of all, it has individualized the approach. In other words, it caters for almost each and every individual, both men and women, all age groups, all classes of social income, social economic classes. Yes, and then it has a perceived susceptibility and severity. Hmm? That's also a defense to this model. It has the cues of action. Cues of action is like the procedure an individual goes through to take action. Then self-efficacy, yes, this concerns the effectiveness in the model. Eh? Yes, uh, this model incorporates the concept of self-efficacy. And self-efficacy refers to an individual's belief in their ability to successfully perform a behavior. You get it? Yes. That's what we mean by self-efficacy. Yes, an individual's belief in their ability to successfully perform a behavior. So therefore, by enhancing self-efficacy, for example, education, building skills, these individuals will be more likely to engage in healthy behaviors. We get that's what we mean by that point of self-efficacy. Yes, their ability to successfully perform the behavior. Then another strength is predictive power. Predictive power. The healthy belief model has a stronger predictive power, whereby it can be based on to predict the behavior, and that's we as health workers. That's what we want. Then weaknesses. This concerns a simplistic view of behavior change. The healthy belief model looks at behavior change as something very simple, very minor. You get it? Yes. And then another weakness is that it has limited focus on individual actions. Kindly, Unzima, Uzmail, try to mute. Dennis. Yes, good. I was saying that it has limited focus on individual actions. Yes. It doesn't focus a lot on what individuals do specifically. You get it? Yes, and then another weakness is that it has a limited consideration of emotional factors. It doesn't consider so much emotional factors, for example, stress, anxiety, fear. You get it? Yes, so those become to be weaknesses of the model. Then going to the other model, that is the theory of planned behavior. Yeah, this theory proposes that individuals' intention to perform a behavior is influenced by their attitude towards that behavior. I guess you get it. The attitude towards that particular behavior they are performing. Please eat fruits daily. Please eat greens daily. You get it? Such behaviors. Please do physical exercises on a daily basis or at least 5 days a week. You get it? So the attitude towards what you're telling them to do is what is perpetuated in the theory of planned behavior. Then towards subjective norms and perceived behavioral control. So according to this theory, intentions are stronger predictors of actual behavior. Intentions, what they are willing to achieve, the goals. You get it? Yes. And this theory, that's what it is stipulates. So, objective norms, like I've said, it is influenced. This theory proposes that behavior is influenced by individuals' attitude towards behavior, towards subjective norms, and I tried to get subjective norms here to refer to their perceptions of social pressure to perform or not to perform a behavior. Social pressure, individuals around them. You get it? Yes, individuals around them. If their fellows do regular physical exercise, that patient will also do. Therefore, it is the theory of planned behavior. It teaches us professionals that whenever you're giving a directive to a patient, mind about their intentions or their goals they want to achieve. Secondly, mind about their social like what the things that surround them. Some people take it as lunch. So preventing the failures of giving rehabilitation. You get. Then perceived behavioral control refers to the beliefs about the individual's ability to perform that behavior. What do they believe? Whether do they believe they can perform it? Do they believe they can't afford it? Sometimes some feel like you're getting money. But I don't have a garden with the fruits, so I don't know what you're talking about. That's what some patients have in mind. I guess you get it. Yeah, and then going now to the I also provide a systematic view of this theory of planning. Yeah, so the theory of the planned behavior, like I've illustrated here, it combines attitudes, subjective norms, and then perceived behavioral control. I think I've talked about these three terms and how they lead to intention, and then intention gives behavior. So how the patient will behave comes a lot from their attitudes, from their subjective norms and control. I've told you before you administer any treatment procedure, look first of all, look at the crew of your patient. Who are the people around them? You get it? Yes. Then the advantages and the find out that this theory has a stronger predictive power whereby it can predict behavior. We can use it a lot to predict how patients behave. Then another strength is that it has incorporation of social factors. It combines a lot. We have seen this, I think, very, very well. It combines a lot of things to do with the who are the people around you. What the things do you do every day? You get it, eh? Who are the people? Your colleagues, you get it. Eh? Then flexibility. This means that it cuts across all gender, all age groups. You get it. Eh? Yes, it is flexible, even across culture, different cultures. Eh? Then another strength is that it has an empirical support. Empirical support, we mean by research has been done to prove this theory. Many researchers are building on this theory to learn more about patient behavior. Then weaknesses. It has an overemphasis on rational decision making. That individuals can make their decisions at any time they want. Yes, it focuses on intentions, and intentions they determine a lot on how that individual will behave. But it overemphasizes on it. That is the weakness. Another weakness is that it has difficulty in measuring variables. Yes. It can measure because the variables we have here, social factors, intentions, you get it, perceived behavior. Those you cannot measure those such variables. Yes, and then another weakness is that lack of a consideration of external factors. It doesn't look a lot on how this individual was brought up. Where did this child grow from? You get it? That is lack of consideration of external factors. Then another theory is social cognitive theory. This theory emphasizes the role of observational learning. Yes, and observational learning is important in development, where the child develops from. Then self-efficacy and outcome expectations in shaping of the behavior. What do they do? When as an how does individuals' development shape their behavior? So this theory suggests that individuals learn from observing others. It suggests that individuals will learn from seeing what you're doing. You get it? And also their beliefs about ability to perform a behavior. That is self-efficacy. I've already talked about this, and these influence their likelihood of engaging that particular behavior. So these individuals, this theory tells us that individuals will look at someone doing something, and then that individual will look at themselves, will put themselves in that line and be like, can't I also do that? For example, we have very many artists, people who sing, people who sing in music. For them, now very many people are having hair plaited. Yet we know that a man literally should not do hair. But because the earlier musicians had their hair plaited, so these others are also trying to copy from them, whereby they look at them and observe and learn, and then they look through themselves whether they are able to have such hair plaited. You get it? So that is observing from others, modeling, and then self-efficacy. So those two terms are what the social cognitive theory bases on. So the strengths and weaknesses of this theory. Strengths are that it emphasizes on observational learning. It emphasizes that individuals look at others and learn from them. And also it has an incorporation of cognitive factors. Yes, cognitive, we said that this includes the personality and other related psychological factors. Then it has a focus on self-efficacy. Individuals look at themselves whether they are able to perform what they have learned from others. That's what we mean by self-efficacy. So this theory has that aspect of focusing on self-efficacy, and it becomes a strength because it is true individuals before doing something actually perform what they want to do. Then it is applicable to various contexts. Yes, cultures, sexes, age groups. That's what we mean. Then weaknesses. It has a neglect on biological factors. Yes, it's a weakness. It look for it does not look at an individual as an individual. It says this individual will learn from someone, but doesn't have the other concept that these individuals actually have some things in mind by themselves. Then it has a limited emphasis on individual differences. It doesn't emphasize it. For it believes this theory believes the person who made this theory believes that people are the same. Me, I will look at someone and watch from them. It also believes that you who is listening or who is attending this lecture, that you can also look at someone and learn the same behavior that I learned from that very someone. Yet that is not true. We have individual differences. Then it also has a simplistic view of behavior, just like the healthy belief model. Okay. Going to the next model, that is the stages of change. This is very, very important in health. You get it? Very important in health and the stages of change. Because whenever you are going to introduce something new in your community, you must look at these stages. Before you tell an individual on what to do or how to do it. Eh? Look at these stages. You get it? Yeah. So this model states that behavior change occurs through a series of stages, and these stages we are going to see them in detail. This model recognizes that individuals may be at different stages of readiness for behavior change and tailors of interventions accordingly. First and foremost, you look at that figure that I tried to put there, that image. Yes, it has the stages summarized very well. And those words aside indeed reflect what is always in people's minds before they seek for health care. Pre-contemplation, and individuals like, no, I don't have this disease. I don't have. You get it? Yes. In this stage, individuals are not yet considering changing their behavior. Eh? I'm not going to do it. I don't have the disease. I cannot do this regular physical exercise. You get it? So they may be unaware of the need for change. They are not aware of that. You get it? That's why in this image, is indicating the individual is saying no. You get it? Yes. And then the other stage from pre-contemplation to contemplation. During this stage, individuals start to recognize that there is a problem actually, and they begin to consider spirit of change. Maybe I have the condition. Try to reflect so much on this image that I put here. Maybe I have the condition. Maybe I think I should start taking some fruits every day. You get it? Yes. That's what happens during conception. So they try to weigh between the advantages and disadvantages of changing that behavior. They weigh between the pros and cons. That's what I mean by advantages and disadvantages. Then number 3 is preparation. Now individuals enter the preparation stage, and here they are ready to take action. And they are no longer contemplating. They are sure they have to change their behavior. I've told you these stages. You must at least have a healthcare professional have these stages at fingertips because they will help you a lot whenever you are engaging your patients or communities. So they may start making small changes, small, setting goals to address the behavior they want to change. They start buying attires for aerobics. They start registering at the gym. You get it, Yes. And then action as number 4, they now take action. You get it, Yes. So here they actively modify the behavior now. They start now doing the real thing. They start taking regular physical exercise. You get it? So here they are implementing their plan. Remember in preparation, this individual came up with a plan. You get it? And in action, then implementing the plan. Yes. So maintenance, this means now compliance or adherence to their actions. You get it? Once individuals have successfully changed their behavior, they enter the maintenance stage. And here, they work to prevent relapse and consolidate their new habits. You're seeing in this image that relapse is going backward. You get it? I think we can all see that. The relapse is actually going a reverse arrow. This means that when an individual moves from pre-contemplation to maintenance, then when they reach maintenance, they sometimes fail to maintain. Hmm? They fail to maintain and they instead try to go backward and they now go back to contemplation. Contemplation. Eh? Ah, why was I even struggling with these exercises? After all, I don't even have motivation. You get it? They tend that arrow illustrates relapse. You get it? Relapse is like they start they no longer do the physical exercise. You get it? Yes. Uh, that's what we were meaning by maintenance. Then the strengths of this model, that it has a comprehensive framework. Those stages. That's what we mean by comprehensive framework. Then individualized approach, whereby it is applied almost on each individual. You get it? As in each individual relies on their own. That's what we mean by individualized approach. It has a strong predictive power, whereby it can predict behavior. You can rely on this model to predict an individual's behavior. Then another strength is that it is flexible, can be applied almost across all cultures, whether African culture, whether Western culture. Then it has a practical application. We can apply it even in daily life. That individuals, before taking any action, they will actually go through those stages. That's why I have told you that please be focused on these stages so much because they are very, very important when we are implementing the healthcare. Then weaknesses, it has over reliability on individual self-reported data. Eh? Sometimes the research made on on these stages of change model, they ask people or they ask them by mouth, do you do this? Did you go through this stage? Yes. Even if they didn't go through, they will say yes because they know they have to provide a positive answer. That's what we mean by self-reported data. And what these stages of change, they overlay on such data, and it tries sometimes it reduces the validity of that data. You get it? Then it also has a simplistic approach. It simplifies behavior, takes behavior as a very something very simple. You get it? Yet actually behavior is very complex. Then self-determination theory. This theory focuses on intrinsic motivation and autonomy. Autonomy is like self-decisions, self-control, self-regulation. You get it? And then motivation. And this theory says that these two factors, um, they help a lot in driving behavior change. You get it? So it suggests that individuals are more likely to sustain healthy behavior when they feel autonomous. They will do as you're telling them so long as they realize that they are doing it on their own. Hmm? Whenever they feel competent for it, competency, and then whenever it is related to others in their decision making process. So I provide that is systematic diagram whereby self-determination theory combines autonomy, competence, and relatedness. You get it? Related to others in a decision-making process. See? So the strengths of this theory are that it has a universal applicability. It can be applied almost across all cultures. It has an enhanced motivation. An individual does their own motivation. Hmm? Self-determination. Yeah, they're determined. And remember, what it drives the determination is the autonomy and the competency. Whenever they feel like, yeah, I can do this, you get it, I can do this exercise every day. That's what we mean by competence and then autonomy. And easy to enhance motivation. Then, whenever they have positive outcomes, yes, this theory has positive outcomes, and that also enhances motivation. And then another strength is that it can be applied practically. We can perform experiments. We can do particular studies regarding this theory. That's a strength. Then weaknesses, it has an overemphasis on autonomy, whereby it overemphasizes that an individual performs a behavior on their own. Yet, yes, we believe that individuals perform behaviors on their own, but also other external factors come in. The parents this child grew up with, the social capital, the members they live with at home. You get it? They also influence patient behavior. However, this theory says individuals behave because they want to behave like that. Then cultural variability, whereby it does not adequately account for cultural differences. You get it? Yes, and then it has a limited predictive power, whereby we cannot use it to predict behavior. You get it? Since it is based on autonomy and competence, you cannot look at someone individual's autonomy. You cannot look at individual's competence, whether they can do something as far as this behavior is concerned. That's if you're using this self-determination theory. Then perhaps the last slide, we are talking about the role of these beliefs and models in understanding the patient. How are they helpful? First of all, they help us understand patient motivation. What motivates patients as far as certain treatments are concerned. You get it? Then they can also be used in predicting health-related decisions. We can predict what an individual shall decide when we are basing on these models. We can also use them to identify barriers to adherence to treatment. You get it? Yes, we try to use these models and beliefs to get what really hinders patients to adhere to drug, what limits their compliance. And then another role is in promoting patient empowerment. Yes, it has a role in promoting patient empowerment, whereby it improve these models. If you learn them, you improve patient rights. You get it? Yes, you also consider ethics in place before you perform any procedure. But this comes because you have learned a lot about the models and beliefs in health, in patient behavior. Then the last role is in enhancing communication and doctor-patient relationship. You get it? Yes. Enhancing communication. Whenever you understand an individual's behavior and you have based on these beliefs and models, you enhance communication between them. We also use these models to learn on the best way to relate with our patients. This marks the end of this lecture. I guess we have tried to achieve our objective. I always put back at this screen for the lecture objective. You reflect on whether we have achieved the objectives of this lecture. And in case we have achieved uh, just hope anyone can say something that everything has been okay. So some of us will join in late. Some of us will join in late, but at least. So anyone just to give a comment, perhaps on the speed I'm just trying to adjust. At least it is not so easy. However much it might not be the one which is required. So someone just to say something. Mr. Sam, in case you can try to stop the recording. Such that you can try to stop the recording. Yes, problem.
Yeah, good evening. Thank you very much for the lovely lectures. It was so nice.